Hello and welcome to CyberPatient. You will use the CyberPatient platform to accelerate your healthcare careers and advance medical education globally. This first scrub-in video introduces you to CyberPatient and walks you through the skills you will need for Level 1. What is CyberPatient? The best way to describe CyberPatient is a safe and diverse virtual training hospital available 24/7. We offer 130 virtual patients for you to treat. We are the textbook come to life. Once you log into the CyberPatient platform, you arrive at your student dashboard. Adjust your skill level in settings. This video covers Level 1, which includes history taking and the patient chart. On the right, we see a summary of my last case performance. Now we can open up today's class. When opening up a class, you see the recommended skill level and required passing score above here. We also have our course performance summary, which will update as we go throughout the class and complete cases. If we scroll down, we see the cases assigned to the class. Lastly, your instructor will provide support via formative assessment as you attempt cases. The feedback will be shown here. Once clicking on a case, we see an overview of the patient profile. We also have a list of tutorials available for each section if you need prior support. Let's begin.
Hello, I'm Dr. Smith. I'm the on-call doctor today.
Hello, Dr. Smith.
Every case begins with history taking. To make this platform accessible worldwide, we can translate the interface into 72 different languages. We also have the patient chart, which we will discuss later. The Help button allows you to watch a tutorial on this section and refer to some FAQs. Now back to the case. This section is based on medical school's classic method for history taking. The questions are categorized. We have patient information, chief complaint, history of present illness, and so forth. If we open up our first category, we can ask a question.
What is your name and age?
My name is Jeremy Ramsey and I am 37 years old.
Now into chief complaint.
What seems to be the problem today?
I have heartburn and burning pain in my lower chest.
The questions are based on relevancy. So if I ask a question that is irrelevant to the case, I will not be granted any points. For example,
How is your financial situation?
Good.
we will see at the end of the case that we did not receive any points for asking the irrelevant question. Once you are comfortable with history taking, you may search for a question based on keywords. For example, if we want to ask about spicy food.
Do you eat spicy food?
Yes, I love spicy food.
We have about 150 to 200 questions available per case. Make sure to think about the questions you are asking and focus on the most relevant ones that help you determine a differential diagnosis. Be aware of the time and cost to both you and your patient when asking questions that are not relevant. You will finish history taking by filling in the patient chart. This is where you will document your findings and provide reasoning. If we scroll down, we see some tips for easy chart taking. It is important to fill out your chart at the end of each stage, as your instructor will use this to provide feedback to you. Please note that the chart needs to be filled out before completing the case. Once you submit the last stage of your case, you will not be able to edit the chart. This brings us to the end of Level 1. We are now directed to the intelligent tutoring system that calculates your results based on 3 indicators: knowledge score, time, and cost of care. These indicators are individually broken down in each section as well. As hospitals and textbooks are not able to provide this detailed level of documentation, this is a key benefit to CyberPatient.
If we open the History Taking tab, we see those 3 indicators, score, cost, and time, broken up. Clicking on Feedback lists the questions that I chose. My questions are identified based on relevancy, and I only receive points for questions that are most relevant. The score here is very low, as I did not ask enough most relevant questions. Asking about the financial situation was less relevant. To help you in your next attempt, the right features questions that you will want to ask. Lastly, I will show you the patient chart. As we can see, my recordings were saved along the way. We can export it as a PDF or print it out.
Your instructor has access to all this data, including the patient chart. Although the cost awareness is based on Canadian hospitals and will vary in each country and in each hospital, this feature is used to show you how your decisions, such as ordering unnecessary exams, can affect the cost to you, your patients, and hospitals. You can now monitor your progress in comparison to your classmates with the progress graphs. You are now ready to scrub in for Level 1. From the team here at CyberPatient, we are so excited to connect with all your bright minds from around the world. Good luck, have fun, and happy learning.